Welcome to Mental Health Colorado's 2017 Legislative Education and Advocacy Day. I'm Mo Keller, Vice President of Public Policy for Mental Health Colorado, and with me is Debbie Plotnick, who is Vice President of Public Policy and Strategic Engagement for Mental Health America National. She's going to begin with a slide presentation on things that are going on in Washington right now with the new congressional effort on replacing the Affordable Care Act. And then I will be speaking after her about the state budget, some of how the federal effort might affect individuals in Colorado, and what some of our challenges are with the Colorado state budget. So with that, I'm going to introduce Debbie Plotnick.
Thank you, Mo, and thank you folks around Colorado and anyone else who is and listening to today's webinar. To start with just a little bit about Mental Health America and why history matters. That's the bell of hope. I think it's very important, and every day we remember where we came from. This was smell shackles and chains that were collected from all around the country from asylums. So when we go out and do our work, we remember that mental health and substance use needs have always been at the bottom of the list of legislative priorities, and people have been treated abysmally. And as I talk about continued advocacy, you'll see why it's important to keep in mind. Mental health philosophy is before stage 4. We've been trapped in what we call stage 4 thinking, which is that mental health conditions the only health conditions that as a matter of public policy, we wait until stage 4 to treat, and then often only through incarceration. Mental Health America is working to shift that paradigm. Our before stage 4 philosophy has 4 components: prevention for all, early intervention and identification for people who are at risk, integrated care and services and supports for people who need them, and recovery as a goal for all. We started a screening program at Mental Health America, and I'm going to go through this very quickly just to show you that the things that advocates have been talking about anecdotally for many, many years are showing up and proving to be true on our website that we about 2.5 years ago. With no fanfare, we put up a screening site, and thus far, in slightly over 2.5 years, we've had 2 million people come to take our screens. We have, as you can see from this slide, screening for depression, anxiety, bipolar, PTSD, a youth screen, a parent screen, an alcohol substance use screen, and psychosis screen. We think screening is important because it promotes recovery. People who screen regularly are attuned to what's coming, what they're feeling. They're more knowledgeable about their conditions. The fact that they're screened means they know something. They're better able to communicate what it is happening with them. They're able to recognize improvement and build on it. They're also more aware of warning signs of relapse. They're better able to self-manage their condition and their needs. We know that just at the end of last year, 2016, we had over 2 million screens. People demographically give us, they give voluntarily rather, demographic information, and it closely follows census data as to what the demographics are. We know that just under 2% of the people who screened come from Colorado. That was more than 10,000 screens just last year. And we find that the screeners who took our screens from Colorado pretty much follow national screening. We really find the same consistencies throughout this. The majority of people come for depression, just over half. We know that next popular in terms of what screen to take is bipolar and anxiety, and then psychosis screens. Now here's the really important part that we have seen proves what we've been saying. We know the vast majority of people who come to take our screens, our data bears out that they are young. In fact, more than a third of them are between 11 to 17. More than 3/4 of them are young people under age 35. We know that this is bearing out what we've been saying about mental health conditions show up in childhood and certainly by adolescence. We know that the folks who come to our screens, who take them, are screening positive. Almost 3/4 of people who take one of those screens are screening in the moderate to severe range. And this is information they didn't have before. And most of them, again, 2/3 of them, have never been diagnosed. So we know the need is tremendous. And we're following the same kinds of things. People are taking the screenings and they're finding the positive results pretty much in the numbers taking the screenings. We also know that people who are coming to take the screens, when we ask them about things going on, they almost always have other co-occurring conditions. So this brings us to the where we are and where we might go. And I want to start with just a little bit of a reminder of the legislative process around health care and health care reform. We know that we have the Affordable Care Act, the ACA, which is also known as Obamacare. We know that there's a political will and an effort right now on Capitol Hill to repeal the Affordable Care Act under Obamacare. Here's the process that is going to be used legislatively. It is using a process called budget reconciliation. Budget reconciliation can only affect the pieces of the ACA that have a budgetary effect. Now, what's different about budget reconciliation is that to pass, it only needs a simple majority of 51 votes in the Senate. All other things need a 60 vote threshold. And there's a special rule that's named after Senator Byrd, the late Senator Byrd from West Virginia, that says if it of the bill that are put into budget reconciliation, if they don't have a budget impact or extraneous, they can either be excluded straight away or they can be voted on the regular rules with a 60-vote majority. So it's very in how this bill may or may not get passed. So a draft bill of the so-called replacement bill, if you will, the new bill, it was kept secret. We saw it earlier in February, but the replacement bill has many similar provisions. In fact, we were pretty clear on what was forth. The new bill is called American Health Care Act. So this would be sort of, if you will, to use the colloquialism, replacing Obamacare with Trump care. The American Health Care Act is the new proposed law. And I'm going to elaborate on what would be in it and what would be different. But first, I'm going to say why Medicaid is particularly essential to people with mental health and substance use needs. Traditionally and continually, Medicaid has been the largest payer of mental health and substance disorder treatment and services. 31 states, including Colorado, expanded Medicaid. In fact, in Colorado, 400,000 new people came into the Medicaid system getting coverage, and 70% of those folks are employed. These are people who didn't have insurance who now have it. And 1/3 of Medicaid expansion folks, and this holds true for every state, 1/3 of them has a mental health or substance use need. Of course, Medicaid in the expansion population also covers general health. Proposed changes to Medicaid under this proposed new health law would mean that the expansion would be phased out. Now, states that have not chosen to expand still could until the end of 2019. But after the end of 2020, no new states could join in. Right away, the extra money that came under the Obama, the ACA, the FMAP will go away, it will be completely gone by the end of 2019. Very importantly for folks with mental health needs is that this new law would fully repeal the essential health benefits. So it would mean that states could choose what benefits they will cover in their Medicaid law and if they cover them at parity. So they could choose not to cover mental health and substance use services. Unlikely that they wouldn't cover them, but they would no longer have to cover them at parity. It also would repeal something called presumptive eligibility. And that means right now, if someone in a mental health crisis comes into an emergency room, needs to go in a hospital, they would be accepted and they then would be assumed to be eligible for Medicaid, and they would start billing Medicaid from the minute they walked in the door. That would go away under the new rules, except for presumptive eligibility would end except for children, pregnant women, certain types of cancers, breast and cervical cancer. So right now, what are people getting under Medicaid and what would they be getting? After 2020, there wouldn't be any who'd be able to come in under those expanded rules that are based just on income. So it would mean that we'd go back to the bad old days of childless adults who were not disabled or didn't fit into a special category would not be able to get Medicaid, and the extra money that states got would go away. The people who came in while extension was in place would be able to stay, but if they lost that eligibility for more than 30 days based on their income, wouldn't be able to get back in under old rules. And under this new proposal, states would have to redetermine their Medicaid eligibility every 6 months. The big change to Medicaid that is posed in this new Trump administration bill is called Capita Caps. And that means that beginning fiscal year 2020, there will be a set amount per person. The base year that the amount would come from would be 2016. The set amount per person is based on targeted spending that would come from adding together all the enrollment status that people have, all the different categories. They would figure out what your per person, that is per capita rate would be, depending on what category of Medicaid eligibility you came in under. Were you older? Were you blind? Were you disabled? Are you a child? People who came in under the non-expansion rules, states have different rules, or the expansion, and so the per capita amounts were different. There would be increases that would come every year to what the amount each state would get per capita. It would be a raise based on the index of how I have on this consumer price index that's since been modified to the healthcare index, how much the rate across the country things are going up. So it would increase a little bit every year. But if the state in any given year spends in all its categories more than it was expected to spend, then in the following year they would get a reduction in the amount they got per person. Now, things would be a little different too under this proposed health law in the insurance market, the marketplaces. The biggest thing and concern for folks with mental health substance use services, as well as just about everything else, that it would undermine the essential health benefits, which would mean that all plans now are required to cover many different things, including inpatient, outpatient, rehabilitation, medication, substance use, and mental health services at parity. But those no longer be the same. They would be changed in a way that they wouldn't be repealed, it would be in Medicaid. However, plans would again allow to sell insurance plans on the open marketplace that didn't cover those things. And there would be no penalty for doing so. So the penalty for not having them would be zero. So essentially, they would be disappearing as well. There are also major changes in the marketplace to the premium supports that now exist under ACA or Obamacare. Presently, the amount of subsidies depend on how old you are, where you live, and your income. So they would be replaced only based on age, not income, and not geographically. Healthcare across the country are very different, but it wouldn't make a difference under this proposal. It would be a flat tax credit for people who make under $75,000. So over that, they wouldn't get anything, but under that, they would get a flat, if you're under age $32,000, between 30 and 39, $2,500, between 40 and 49, $3,000, between 50 and 59, $3,500, and coverage for people over age 60 would be a flat $4,000. A difference also would be that right now under ACA, Obamacare, insurance can only charge people over 60 3 times as much as it charges younger people, and that would be raised to 5 times as much. Okay, and there were also some changes in income limits, and there are tax advantages, but they're not an advantage for everybody. So there would be full tax credits, the numbers I just went through, for people earning under $75,000. Or households that earn collectively $150,000 or less. No tax credits whatsoever for people making over $215,000 and $290,000 for joint filers. So tax cuts, though, for people with means would be a big part of this, and they're kind of baked into this proposal. So if you have more money, you will be able to take more dollars out of your income that have not paid income tax and be put into either a flexible spending account or health savings account. Now, people can certainly do that no matter what their income is. People with low incomes have less to put in. People with higher incomes are able to take more of flexible income and avoid paying income taxes by turning it over to pay for insurance premiums or co-pays or any kind of qualified medical expense. The other thing that is very important in this new proposal is that there's no way to pay for the tax credits even though reduced. It repeals all of the taxes that we're paying for the ACA, such as the employer tax, medical device tax, and a tax on tanning. There are a lot of different taxes. They are all repealed under this plan. It also would repeal the mandate to have insurance. So the idea behind the ACA was that everyone was required to have insurance. That's how you get shared risk. Well, this shared risk mandate would go away. No longer would people be required to have insurance or employers be required to provide it. However, most people do want insurance. And under this plan, if they don't have continuous coverage and they want to come back in, they would, if they had an interruption for just over 2 months, 63 days, they would get a 30% surcharge put onto that first year's total cost. That 30% surcharge is in effect a tax, but it wouldn't go to the federal government and it wouldn't go to the state. It would go directly to the insurance company. So a lot of people might be expected to not buy any kind of insurance because there's no penalty, and they might wait until they're sick. Then when they're sick and they really need it, okay, for 1 year there would be a 30% surcharge going to the insurance company, but they would be guaranteed buying it because, again, the pre-existing condition limitation would go, that would stay, just like it's in Obamacare now, it would stay in the new proposal, so they'd have to get some kind of coverage. It would be expensive, and it would be 30% more on top of that. And people with mental health and substance use needs are particularly vulnerable for penalties because all too often they have interruptions in coverage. So as I mentioned, the things that are unchanged in pre-existing coverage also is not changing, and young people may also stay on their parents' insurance until they're age 26. But as soon as you hit age 26, during the next open enrollment period, they have to buy something on the exchanges. They would get that $2,000 tax credit to do it, which probably won't cover anywhere near what they need covered. So if they're not employed and they weren't able to purchase it, they would get that 30% surcharge when they would try to get it when they need it. So what do we need to do about this? Well, we really need to add your voice. We need to add everybody's voice. And we need to make it clear why this would hurt individuals, it would hurt families, and it would hurt our community. And what we know are the most effective things to do right now, we have to pay attention with respect to this proposed plan, if you will, Trump Care, is we've got to call our elected representatives in Washington. We have to let them know this is not okay. I have a slide here with Karen Howard. She worked with me on my team at Mental Health America National, and Karen is our advocacy manager, and she's a former congressional staffer. She has worked for several representatives on the Hill, most recently Steny Hoyer of Maryland. And Karen says that the most important thing you can do is call, pick up the phone. Other things are important too, but it's that phone call. And you're most likely to get through to, even though it's your national representative, you can call them in Washington, but you can also call a regional office, and you may be more likely to find the phone lines less jammed if you call there. But nonetheless, call them. If you don't know who they are, go to the website, www.house.gov, and you'll find by just putting in your zip code who your congresspeople are. That's on the House side. This proposal is going to first go to the House of Representatives for the vote. So right this minute, it's essential to call the House members. And you can, from the slide, Karen's done a little script for you. Tell them your story. Tell them you live in the district. Tell them why it's not a good idea for your family or your community. Can also put it in writing. And one of the most important things that has just gone into writing, we offer our heartiest thanks and congratulations to Senator Cory Gardner of Colorado and his colleagues, Rob Portman, Shelley Moore Caputo, and Lisa Murkowski, who are all Republican senators who stood up to their leadership in the Senate and said, this bill's going to hurt people. And in their letter, they specifically said it will hurt people with substance use and mental health needs, which in fact it will. And they reminded their colleagues, as you can too, when you call and say that the Congress has just passed sweeping mental health and substance use legislation last year called the 21st Century Cures Act. It was something that was shepherded along and in large part is due to the wonderful efforts of Colorado Congresswoman Diana DeGette. And if these changes happen, many of the provisions of 21st Century Cures will not be able to happen because people won't have coverage for the types of things in there. So tell your not only Congress people, but tell your senators and call senators like Senator Gardner and say, thank you for standing up for mental health and substance use disorder. We at Mental Health America have been writing letters too, and we had our affiliates join in. So it's coming from our national and our local representatives together, and we've sent it to every member of the Senate. We have also, of course, been writing, calling, and visiting the House members, but it's most important they hear from you, and they hear from you in district. I live in district, and I need to hear from you. So this is a picture of me. And this is a picture of me telling some important people on Capitol Hill what I think and what I think about how this is going to hurt people. The people in the panel sitting there are Congressman Frank Pallone of New Jersey, and he is on the Energy and Commerce Committee. He is the minority chair of Energy and Commerce, which is one of the committees of jurisdiction for any changes to health care law. Mrs. Pelosi, Nancy Pelosi, who is the former Speaker of the House, she's currently the minority leader in the House, is in the middle, and sitting next to her is Representative Bobby Scott of Virginia. And his interest in mental health and substance use comes from his high position on education in the House. And I'm telling them I'm telling them why it matters. I'm telling them personally. I'm telling them my family story. I'm telling them how when my daughter was an adolescent, she showed serious signs of depression. She had what her family felt like would never end. 4 years of being suicidal, very difficult. Our family in pre-parity days did everything we could to get help and services to help our daughter. We were lucky that we had some really good credit and the ability to find help for her, but that isn't the case for a lot of folks, and it certainly wasn't before we had the Affordable Care Act, before Obamacare. And my personal experiences are what really directed my policy career and what makes me an advocate and why I fight so hard. So we let people know that it really matters. We tell that story. My daughter is doing terrific. She's back in Colorado, is a happy Coloradan who is about to make me a grandmother, and I'm thrilled. When I told that story to Mrs. Pelosi, she was very happy to hear it. And my understanding from her staff is that personal story and that one matters her so much that she leads with mental health, and she says why it matters, and she thinks about people who it affects and when they got help, what a difference it made. I also told her about my experience working in the field and working with people at our Mental Health America affiliate, where I oversaw many programs from people who may even have gotten mental health services through the county and through the state, but before Medicaid expansion couldn't get the rest of their health needs covered. And if you'll remember from our slides about screening, people almost always have co-occurring conditions. And people who have been in the public mental health system have been there a long time, and they always have other serious conditions. Medicaid expansion helped people who were getting mental health services get the rest of the care they needed, and it helped people who weren't able to be reached before, and it brought parity. So other families didn't have to struggle like mine did to find the funds to help their loved ones and to almost go bankrupt. It's always personal. That's a picture of me and my lovely daughter, Ashley. And remember, when you tell your story, make it personal. Tell your elected representatives. Right now, call the House of Representatives. Call your senators. Tell them it's essential that they do not allow the proposed law to take away Obamacare. Tell them you like Obamacare. Tell them you don't Trump care. If you need to put it in terms that simply, that's just fine. They know what you're saying. So please stand with me on strong advocacy. And feel free to contact us at Mental Health America. We're there to help you. Thank you so much.